Mysore is a very large district with nearly about 187,000 population. Despite a very large population, we only have 3 dedicated psychiatry departments, which obviously means there's a severe shortage of psychiatrists. Outside psychiatrists, there are no mental health trained professionals, so there's a major gap to address the mental health needs of a very large community. India is officially the suicide capital of the world, and the bulk of self-harm is actually reported from South India. So we have one of the highest rates of self-harm and completed suicides.
ಗಲಾಟೆ ಆಗ್ಬಿಟ್ಟಿತ್ತು ಜಮೀನ್ ಹತ್ರ. ಅಲ್ಲಿ ಅವರು 4 ಜನ ನನ್ನ ಹಬ್ಬ ಏನೂ ಮಾಡೋಕ್ಕಾಗ್ತಿರ್ಲಿಲ್ಲ. ಅವ್ರು ಅವಾಗವಾಗ ಗಲಾಟೆ ಮಾಡ್ತಾನೇ ಇದ್ದರು. ಅದರಿಂದ ಇರೋದೇ ಬೇಡ ಅಂದ್ಬಿಟ್ಟು 5 ಜನ ತಗೊಂಡೆ. ಅವಾಗ ಇನ್ನು ಎಷ್ಟೇ ದಿನ ಹೋದರೂ ಇನ್ನು ಅವ್ರನ್ನ ಹಿಡಿಯೋಕ್ಕಾಗಲ್ಲ, ಇನ್ನು ಇದು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದರಿಂದ ಜೀವನನೇ ಬೇಡ, ಅವರೇ ಇರಲಿ ಬೇಡ ಅನ್ನೋ ಒಂದು ನಿರ್ಧಾರ ಮನಸ್ಸು ತಗೋತಾವತ್ತು.
It's a mammoth task in terms of improving the knowledge levels and developing more favorable attitudes towards self-harm and self-harm survivors. We conducted a knowledge and attitude assessment of nearly 760 health professionals. We were very shocked. The knowledge levels were really low and the attitudes were generally unfavorable. Very small, less than 5% of health professionals reported that they had any specific mental health training. None of them had specific mental health training about self-harm. It was very clear that we really had to enhance the skills and competencies of nurses so that on some extent the big gap of the unmet mental health needs was addressed. Nurse education and supporting nurses in their professional practice is one of the big strengths of our colleagues from UK. So we developed 6 to 8 training modules which address both the mental health skills, competencies, the legal issues, the knowledge issues, the issues around stigma, and also the issue related to caregiving and supporting the caregivers.
There's a focus in this teaching and learning initiative on nurses because they're often the first point of contact. If we can change the attitude and beliefs of nurses, we go a great way to beginning to assuage some of the difficulties that we might find with this particular patient group.
When the patient is present in the ward around for 5 to 6 days around, they will give us such a counseling that they don't want to repeat it again. But sometimes when the mental health upset happens, means the patient may again and again they may go for high suicidal tendencies. After this workshop, we may get some other ideas and how to manage the patients.
This project has been planned meticulously with local needs in mind. We spent a lot of time talking to local staff, finding out what local needs were, and designed a package of teaching bespoke to this particular area.
Started my work in the UK on the Wirral.
Still there are many things to learn. So the single day I learned about how to manage the suicidal cases and how it will be and what all the problems they are going to face and how initial steps we are supposed to take and how the therapy and the counseling, what are the roles of the nurses and what we have to do in the separate general wards. And suicidal case not only present in the psychiatric departments, even we can find such things in the general wards also. So today from this workshop I have gained how to manage even the general ward as well as in the psychiatric setup. It was very worthwhile for me.
There are no trained professionals like psychologists or psychotherapists or social workers whose job is exclusively to work with families, and any intervention that families get, even minimal, is restricted to hospital settings and they do not get any support after they get discharged. So this is where we believe if our community nurses, if they gain some mental health competencies, they would be able to follow these subjects or families.
Society looks at the person who is having a mental health problem as something bad and they cannot live along with others. If they have that problem, everybody will put that family down. As a community health nurses, we are the doorkeepers for the hospital. If the nurses are working at the grassroots level and they can promote the health and prevent the illnesses and maintain their health and restore their health. if the nurses are trained well in the psychiatric aspect, like mental health aspect, this will help the nurses to focus their care towards mental health along with the physical health problems. So that will help the community to get more awareness from the nurses, and ultimately that will help in reduction of complicated psychiatric problems.
The World Health Organization acknowledges in a fairly recent report that suicide is a global issue, and that we don't just need to think globally, but we need to act locally, and that means acting locally on the ground. The collaborative nature of working in partnership is absolutely essential for this project. The reason it is essential is that without local knowledge and cultural sensitivity, this project would not work.
In these type of collaborations happens means we can change the exchanging of an ideas, the what they will do and what we can do, and what we are having and what they can have. So the exchange of ideas will help in this type of collaboration programs. And I hope they may conduct in future that not only from the nurses from the Mysore, they can conduct all over from the state, because there are many nurses, there are many suicidal cases happening.